I want to share with you the most common and beneficial therapies for back pain, neck pain, and pain sustained during an automobile accident. I also would like to share with you 4 main questions that our new patients typically will ask on their first appointment. My name is Dr. David Adamson with Bonita Springs Chiropractic Back and Neck Clinic. As I mentioned, there are 4 questions that typically our patients ask. Number 1, what is my problem? Number 2, can chiropractic help with my problem? Number 3, how long is it going to be till I feel better? And number 4, how much is it going to cost? Well, let's talk about number 1, the problem. The problem will really come out when we sit down and have a consultation. When you tell me about what's going on and what's caused your problem, give me some history about what's going on. At that point, we'll determine whether or not chiropractic care is right for you, or if I need to refer you out to a medical specialist to help you. Which leads me to number 2, can chiropractic help? Well, during that consultation, if I feel like the chiropractic care will be helpful for you, we'll move on to what we call a physical exam. That physical exam has multiple components. Number 1, we're going to check your nerves. We're going to check your muscles to make sure they're functioning. We're going to look at your range of motion. We're going to see how you're moving. We're also going to do specialized tests that they call orthopedic tests to determine the integrity of the bone and the joints themselves. And if need be, we'll go ahead and order specialized studies such as X-ray to help determine if we can help you. It isn't always the case, but if your case determines that we need to do more studies, that's what we'll do. The next question we always get is, how long is it going to take for me to feel better? This really has a way, this particular problem needs to be answered by understanding the 3 phases of healing: the inflammation phase, the repair phase, and the remodel phase. In the inflammation phase, we'd use therapies or we use techniques to help decrease your pain and your inflammation right away. So it's really imperative that we start off very quickly with that. Second phase is the repair phase, where the tissue is actually repairing. And we do things to really help you repair. We start including other therapies. Thirdly, the remodel phase, where the structure needs to be strengthened. And we use active therapies to try to do that, to help best provide you the least amount of permanency of your injury and also decrease the amount of a reoccurrence of the injury. And by doing the active rehab, we can actually have an effect on both. But the thing I want you to understand the most, the day that you walk into our office is the day we're going to help you. We're going to try to help you get out of pain immediately. And the last question is cost. Cost is always a concern to all of my patients. Well, there are 5 categories for cost that I want to cover with you. Number 1, major medical, like Florida Blue Cross, Cigna, Aetna. There's a variety of major medical plans out there. Co-pays can range anywhere between $30 to $50, and deductibles, it really does vary based on your particular plan. We also take Medicare, Medicaid. Medicare, Medicaid typically will have a copay of anywhere between $5 to $10, and then deductibles again can change depending on the type of Medicare plan that you're on. Then we also look at PI and workman's comp. Those particular plans are usually paid for by the insurance company directly. So there are no copays and there are no deductibles. So our patients have no out-of-pocket expense. And then lastly, cash. Cash, typically the patients who pay us at the time of service typically will pay anywhere between $40 to $50 per treatment based on the condition that they're dealing with. We are here to help you, and we want you to give us a call at 239-221-7123. We look forward to helping you.